And I ask that Senator Collins, myself, and Senator Cassidy be able to have a colloquy.
Without objection.
Okay. As most of my colleagues know, I hold a meeting in each of Iowa's 99 counties every year for Q&A with my constituents. And over the last couple years, without fail, Iowans bring up skyrocketing prices of prescription drugs. It's people all over my state, including farmers, factory workers, and especially senior citizens, who raise the concern that pharmacy bills are ballooning. And I'll say Iowans are always interested in hearing about solutions, and they're looking for solutions on this issue from Congress. But not a single one of these people that bring this issue up cares about the partisan politics of the issue. They just want Congress to act. So this is my 40th year taking questions in our 99 counties, although as of now, only 14. Rarely have I heard so much unanimity when it comes to this issue. But on prescription drug prices, it's unanimous. Republicans, Democrats, and independents alike all want us to take action. And the data, both polling and otherwise, bears out our constituents' concerns. As I highlighted last week, right here in this position on the Senate floor, a new study shows that pharmaceutical prices have increased 3.5 times the rate of inflation in recent years. People are paying more than double what they paid in the year 2007 for drug treating conditions all the way from MS to diabetes and everything in between. The lack of transparency and the enormous subsidy incentives is driving these price hikes, perverse incentives that we have in law. Or if they weren't intended to be perverse incentives, people have found out how to benefit from perverse incentives. And this is because the government spigot is all the way open for the big pharmaceutical companies, or how we say it around here, big pharma. And of course, when this happens, taxpayers are getting ripped off. And it happens because we pay a lot of money, I think about $138 billion for Medicare and Medicaid, at least that much. And so when you have 5 to 10% increases on January 1st, you can see willy-nilly on the judgment of Big Pharma, the taxpayers are paying a heck lot more. I know all of my colleagues want to do something about this. And I know the administration wants to do something about it as well. In fact, let me say to the administration, I've been involved in this as chairman of this committee just since a year ago, January. The administration gave a major speech, and the Secretary of HHS has taken major action going way back to June of 2018. So we all know that our colleagues and our administration knows that something needs to be done. We're fortunate that just yesterday, the White House published 5 principles for reducing prescription drug costs that the administration can get behind. Our legislation in the Senate fits the bill or the principles that were laid out in that op-ed piece. The Prescription Drug Pricing Reduction Act is the name of our legislation, addresses those principles. But more importantly, it's the only option that can get 60 votes in the United States Senate. Today, many Americans are reading about the coronavirus issue. It scares our constituents. We don't know what kind of drugs may come into the market to help treat disease. Senator Cassidy, who will soon be speaking, is an expert on that, and he can address those issues for anybody that wants them addressed. But if our bill becomes law, we know that folks on Medicare won't face sticker shock at the drugstore counter. Not only is that important as a comforting thought in the short term as we face the coronavirus, but it is important in the long term when we inevitably encounter another novel outbreak. It took a long time to hammer out the bill that we describe as the Prescription Drug Pricing Reduction Act. And I have to thank Senator Wyden for sticking it out with me and working in good faith for the benefit of all our constituents so we could produce a bipartisan bill. His determination, as well as the leadership of many of my colleagues like Senator Cassidy, Senator Collins, Senator Daines, have further improved the legislation. We have a bill, we have bipartisan support, we have White House support, and we have the opportunity. So, bottom line, let's act. And I thank my colleagues for joining me in this effort, and I'm going to yield now to my colleague, Senator Collins.